Today, over 59 million Americans suffer from a condition called dry eye. And in our area where pollen is a problem, that can be a constant irritant. Well, here to talk more about the problem and how to know if you have the problem is Dr. Gulani, University of Florida ophthalmologist at Shands, Jacksonville. Good afternoon, Dr. Gulani. Thanks for joining us.
Good afternoon, Joyce.
What's the best way to describe dry eye, and give us some of its symptoms?
Dry eye basically is a symptomatology endpoint where patients complain of various sensations, which can be delineated right from feeling dry to feeling gritty or sand in the eye kind of feeling. What is more important is the fact that my desire to subspecialize this disorder and to categorize it, whereby you can treat it effectively, not in a generalized fashion as it's been until today. As you can see, over 59 million people in this country alone are affected by this relentless condition. And more importantly, as I teach LASIK surgery abroad and nationally, I have seen over nearly a decade of teaching this is that ocular surface has to have its desired respect.
So, Dr. Gulani, there's going to be a free screening. What is involved in that screening?
We're doing a free screening starting tomorrow and day after tomorrow for 2 days, where we are using a very specialized equipment which tests the tears and the chemical analysis of the same and thereby break it down into categories where we can treat it effectively. So we're going to have patients who are going to come in, they're going to actually collect a sample of their tears, and that tear sample will be chemically analyzed and treated. And
what happens to you if dry eye continues and goes untreated?
Dry eye itself, by itself, is very distressing, but if it's left untreated, it can lead to degeneration of the cornea as an endpoint. It obviously affects your vision, which can be seen in many refractive patients that I see. Your outcomes after refractive surgery can also depend on the tear film in front of your cornea. So it has a visual to a symptomatic endpoint.
Thank you so much, Dr. Gulani, for joining us. Again, the free screenings will be held at the University of Florida LASIK Institute. That's from 8:30 in the morning till 4:30 in the afternoon. That's Thursday and Friday, November 14th and 15th. For more information, call 244-9I or 244-9393.